Types of patients. Patient education occurs in a wide array of settings, which can be categorized as formal and informal. Formal patient education may be delivered in a variety of settings, such as throughout the community in the form of media, in educational and group settings, or in a planned, goal-directed, one-on-one session with a patient in an outpatient or acute care setting. Formal education usually has goals set by the educator, or in the case of patient education, the nurse. Informal education is usually learner or patient-directed. This type of education may occur when a patient asks a question about a medication, treatment, or procedure. The healthcare information is considered informal because it is situation and patient-specific. Some patient education sessions have formal and informal elements because the nurse and patient may set goals together before the nurse formulates and implements the plan of care, and the patient is free to ask questions that may direct the session. Patients are inundated with information from the internet, television, radio, newspapers, and community programs. Nurses can help patients recognize reliable sources and accurate information. More information on helping patients evaluate sources of information is found in Chapter 15. Many healthcare consumers begin receiving information as children through their primary education. Hand washing, proper dental care, and nutrition are examples of early instructions. The dangers and risks associated with smoking, drug or alcohol abuse, and drunk driving are taught throughout their secondary education. College students are provided with education intended to promote health and well-being. Healthcare education continues in adulthood in the form of medication commercials, nutritional food labels, and information obtained from internet sites. Teaching is imparting knowledge or giving instruction, whereas learning is acquiring knowledge or skills throughout instruction or experience. Teaching may be delivered in acute care, long-term care, and outpatient settings. Examples are instructions given regarding a new prescription at a doctor's appointment, information about the need for dietary supplements in a long-term care setting, or a post-operative or discharge instructions for the patient in a hospital or other acute care facility. An example of patient education provided for patients with diabetes is outlined in box 14.1. You can read it. Consideration must be given to the patient's background, readiness to learn, and current condition before education can occur. A patient's ability to read, write, and comprehend healthcare materials enhances health literacy. Domains of learning. To provide effective patient teaching, the nurse must be aware of the three domains or types of learning: cognitive, psychomotor, and affective. Effective patient teaching requires knowledge about how the individual learns. Cognitive domain learning comprises knowledge and material that is remembered. Memorization and recall of information is needed for the learner to remember, understand, apply, analyze, evaluate, and create new material. Learners in the cognitive domain integrate new knowledge through first learning and then recalling the information. They then categorize and evaluate, making comparisons with previous knowledge that result in conclusions related to the new content. Some examples of teaching methods in the cognitive domain include literature written at the appropriate reading level, demonstration, and use of examples. A patient who remembers the information taught during an education session repeats the information and is able to ask questions to further enhance knowledge gained is functioning in the cognitive domain. Psychomotor domain incorporates physical movement and the use of motor skills in learning. Teaching the newly diagnosed patient with diabetes how to check blood glucose is an example of psychomotor skill. Having the patient observe the nurse demonstrating the skill and then demonstrate it and receive feedback is an effective method of teaching learners in the psychomotor domain. When the patient has successfully demonstrated how to perform the task, psychomotor learning has occurred. Bloom's third style of learning is the affective domain. Affective domain learning recognizes the emotional component of integrating new knowledge. Successful education in this domain takes into account the patient's feelings, values, motivations, and attitudes. Exploring these patient-specific attributes enhances the value of the learned information. A patient who readily receives the information taught responds to the nurse with active participation and values the importance of the teaching session is operating in the affective domain. Learning styles. Understanding how individuals learn is important for nurses to consider when considering the written or verbal information they are teaching. Although research has shown that most adults read at an 8th grade reading level, 20% of the U.S. population reads at or below a 5th grade level. That's crazy. Nurses can supplement materials that are written at a high reading level with photos, drawings, and explanations of terms that are difficult to understand. In addition to being aware of learning domains and the materials used to teach patients, nurses must give consideration to the learning styles, strengths, and abilities of the individual. Tools have been developed to help healthcare workers evaluate the health literacy of their patients. One such tool is VARK, verbal, oral, read, write, and kinesthetic assessment of learning styles of people who are having difficulty learning. The VARK areas are evaluated to educate individuals on the basis of their learning preferences. The VARK developers have written other assessment aids that are available online. Some are designed to assess learning styles on the basis of language, age, and the purpose of the evaluation. Some versions are directed at business, and others are specific to education and may provide valuable learner-specific information to assist the provider of healthcare information and the patient. Individuals typically learn through more than one method. For example, a patient's VARK assessment may indicate learning through VAR or ARK. When the use of more than one style facilitates learning, the individual is considered multimodal. A multimodal learner, meaning that the person does best when more than one teaching strategy is used, or that the person is able to adapt to a variety of teaching strategies on the basis of what is being presented. Understanding how patients learn best makes collaborative learning plans most effective. It is good practice to provide multiple means of learning because most individuals learn through more than one style, and repetition enhances learning. Factors affecting the health literacy and patient teaching. Many factors affect patients' health literacy. The educational level of the learner and the instructional materials were discussed previously. Factors such as age, culture, language, environment, nature of the content, and current situation, including level of pain, medications, timing of instruction, and economic resources, also must be considered. Box 14.2 addresses some diversity issues that should be considered in planning patient education. Adjustments to factors that are within the nurse's control, such as timing of instruction, are often necessary to achieve the maximum benefit of the nurse-patient interaction. Age and developmental stage. The patient's age directly affects the instructional methods and materials used. Effective patient education involving a child requires the presence of a parent or a caregiver who is likely the target of teaching. Children should not be excluded from the learning session unless exclusion is deemed appropriate by the parent or caregiver. A presentation using an age-appropriate strategy may complement the instructions reviewed with the adult. The stages of development, see Chapter 17, should be explored as the foundation for the choice of educational materials. Learning theories as they relate to developmental stages are also discussed in Chapter 17. Adult learners tend to be self-motivated and able to participate in planning their health education. During a visit to an outpatient facility or inpatient hospital, an adult learner may learn independently, may have learning facilitated by the nurse, or may need a spouse or significant other for support depending on the diagnosis and current condition of the patient. The pace of adult education sessions depends on the patient, the situation, and the difficulty of the content. Teaching should be tailored when elderly patients are being educated. Older adults are one segment of the population vulnerable to low health literacy due to educational level or cognitive decline. Although each patient must be assessed individually, cognitive and sensory alterations often occur with aging, and the teaching materials should be adjusted accordingly. Role. Exploration of the patient's roles is an important task that must be done before development of a patient education plan. For example, a 32-year-old single mother of 5 young children who has just undergone a hysterectomy may require a different perspective in her discharge instructions than that in the instructions for a 67-year-old woman living with her husband who recently retired after 35 years as a family practice physician. The first patient may have less support and less flexibility regarding rest, lifting limitations, and cost of prescriptions than the second. It is important not to stereotype and assign rules, but rather to develop a plan in collaboration with the individual. The patient support system should be taken into consideration when the nurse plans patient education. Environment. The location of patient education influences the outcome. The setting should be quiet and the session should have minimal interruptions. Providing privacy is difficult in settings such as emergency departments, outpatient surgery centers, and semi-private inpatient rooms, but the nurse should make every effort to ensure confidentiality. Environmental considerations such as good lighting and the availability of resources should be explored to enhance the outcome of patient education. Timing. The nurse should examine the patient's situation and comfort level before beginning teaching. For example, a post-operative patient who is rating a pain of 7 of 10 will be much more receptive to learning after being medicated for pain. A patient who just received a diagnosis of metastatic cancer will learn and assimilate more information later in the day or perhaps the next day. Asking whether a patient would like a family member or caregiver to sit in on the session may affect the timing. The nurse should end the session if the patient shows signs of fatigue. Prioritizing the key points of patient education ensures that the most important aspects are taught at the beginning of the session. Availability of resources. Learning objectives should be determined collaboratively between the nurse and the patient to ensure the availability of resources is congruent with the plan. For example, a patient with limited healthcare insurance and no prescription plan may not be able to obtain necessary medications or dressing supplies after discharge from the hospital. If a need for support services is identified, the nurse should contact the social services department, discharge planning personnel, or community agencies about assistance for the patient and family. Evidence-based practice. Nurses play a key role in providing patients with accurate, unbiased, scientifically sound information. Individuals may not be able to judge the validity of advertisements or medical treatment claims they see on the media. One of the major sources of medication information obtained by patients in this age of technology is the internet. Nurses need to be cognizant of this resource and ensure that patients are eliciting information from reliable sites and that they are able to understand and relate the information to their situation. Evidence-based practice, EBP, is used in patient education to help patients analyze evidence used to validate medical claims and information. EBP is important along with attention to the patient's values and preferences when planning treatments that are required by expertise and practical wisdom. Patients may choose to have or not to have a recommended treatment. Health literacy is woven into treatment plans because nurses must ensure that patients comprehend healthcare information before determining their preferences and making decisions. Patients trust nurses to share with them valid and legitimate information and resources. When exploring the concepts of health literacy and patient education, nurses must recognize the need to work collaboratively with healthcare professionals in other disciplines such as physicians, social workers, dietitians, and occupational, speech, and physical therapists. Riegelman and Gar suggest a framework is needed to connect different healthcare professions when planning and developing patient education. Engaging in interprofessional discussions and planning with the patient facilitate the most effective results. Assessment. Assessment of health literacy occurs with each patient encounter. Nurses observe patient behavior during interactions to determine if further assessment is needed. Certain patient behaviors may indicate inadequate health literacy, which has the potential to affect patient education. These behaviors are exhibited in the following examples. Information on forms is incomplete or inaccurate. Patient wants to take written documents home to discuss with family or asks health care provider to read information aloud stating, "I left my glasses at home." Patient misses appointments or comes to appointments at an unscheduled time. Patient does not follow through with laboratory tests, imaging tests, or referrals to specialists. Patient is non-compliant with medication and treatment regimens. Patient claims to be taking medication or following a treatment regimen, but laboratory or imaging tests do not show expected results. Knowledge or discovery of literacy limits in the assessment stage can aid the nurse in developing the education plan and decrease the potential for life-threatening outcomes. The Agency for Healthcare Research and Quality has several tools available for health literacy assessment. These tools can be used in different settings depending on the needs of the patient. Box 14.4 provides examples of questions to ask the patient. Limited literacy skills may result from a lack of educational opportunity, high school level or less education, learning disabilities or cognitive declines in older adults. Patients' reading abilities may be below standard. Reading abilities are typically 3 to 5 grades levels below the last year of school completed. People with a high school diploma typically read at a 7th or 8th grade reading level. The patient's ability to learn or perform health-related care is essential. Low health literacy, basic or below basic, and cognitive impairments such as memory issues, impaired vision or hearing, or poor hand-eye coordination are factors to be considered in the development of the teaching plan. Special attention should be given to determining patients' learning styles. Asking how they learn best or easily retained information in the past elicits valuable information. Determining the patient's physical, emotional, and cognitive readiness to learn is an essential component of the pre-education assessment. Educational assessment includes designating the learner, patient, family, significant other, or caregiver. Infants, children, and individuals with developmental disabilities need to have an adult as the primary learner. Terminally ill patients and some elderly patients may view themselves as dependent on their caregivers, and they may not want to be involved in learning or may want to have their caregivers present during educational sessions. In ensuring a comprehensive assessment of patient education and health literacy, the nurse should discuss the motivation and willingness of patients or caregivers to learn and review their previous experiences with healthcare learning. Helping the patient identify priorities in learning can determine how to proceed with development of the teaching plan. Adults must place value on need for a purpose of learning. Nursing diagnosis. On completion of assessment, a nursing diagnosis relevant to the educational needs of the patient or caregiver can be determined. International classifications for nursing practice, ICNP, nursing diagnoses specifically related to patient education include lack of knowledge, i.e. self-administration of insulin, supporting data, new onset hyperglycemia patient verbalizes fear of needles, blood glucose levels ranging from 210 to 305. Ready to learn, diabetes management. Patient sitting in bed reading diabetes information or literature left on the bedside table yesterday by the nurse. Patient asking questions about management of the blood glucose level. Literacy problem. Patient expressing a desire to learn but states the literature about how to obtain blood glucose level is too hard to read. Sets materials aside and waits for a family member to read them. Planning. After working with the patient or caregiver to determine the appropriate nursing diagnoses, the next step is developing the patient education plan. Considering the patient's support system is an integral part of this step because it may be necessary or helpful to have someone monitor progress. Collaboration with the patient, caregiver, and an interprofessional healthcare team enhances the potential for a positive outcome. The patient and caregiver, to the extent agreed to. Okay, wait. Let me start over. The patient and caregiver, to the extent agreed to by the patient, should be directly involved in determining the goals of teaching. That was confusing. Determining the outcome statements early in this process directs the remainder of the plan. As healthcare educators, nurses should allow patients to identify what is most important to them. If a newly diagnosed diabetic patient is interested in learning techniques of care that will allow discharge to home rather than to an extended care facility, the patient is more likely to be receptive to learning about self-monitoring blood glucose levels. After the learning goals related to the issues the patient feels are a priority have been met, the patient may then be able to focus on health promotion and avoiding complications. The following are examples of goals or outcome statements. Patient will demonstrate the correct techniques for administering insulin within 48 hours. Patient will verbalize the need to learn diabetes-related information within 24 hours. Patient will demonstrate how to obtain blood glucose levels before discharge. Before developing the interventions to be used in the patient education plan, the nurse should again consider the health literacy of the patient or caregiver. Strategies of assessment were discussed earlier in this chapter, but it's important to understand that patients with low health literacy may have difficulty with the following: filling out complex health forms, locating providers and services, sharing their medical history with providers, seeking preventative health care, knowing the connection between risky behaviors and health, managing chronic health conditions, and understanding directions on medicine. Implementation and evaluation. In all patient education situations, having the patient repeat what has been taught or perform a return demonstration helps the nurse assess the level of learning that has taken place. Healthy People 2020 reiterates the 3 A's of health information identified in the National Action Plan to improve health literacy, which states that health information must be accurate, accessible, and actionable. Keeping these concepts in mind when implementing the teaching plan can guide the information, the approach, and the evaluation of progress. Accessibility needs to encompass getting the learning content to the learner and planning for the use of alternative methods of instruction for individuals with sensory limitations. Use of braille boards or magnified fonts for those with visual difficulties, and amplified media with headphones for those with auditory issues. Box 14.2 provides guidelines for patients with specific needs. Nurses often advocate for patients when other members of the healthcare team have provided information that needs clarification. Making sure that patients understand instructions and terminology and seeking clarification from other providers when needed are part of the nurse's role as patient educator. Environment. To facilitate learning, care should be taken to ensure physical comfort for the learner. Whether in a group or individual session, in setting the stage for effective learning, it is important, for example, to schedule teaching sessions when pain medication has been administered, but the patient is too cognitively affected by the pharmacological side effects of the medication. Attempting to minimize interruption in a quiet atmosphere of respect and trust is also important. Nurses may have different values or priorities from those of patients, and they must take care to provide a non-judgmental environment. Pace. Teaching sessions should focus on one idea at a time and should be kept short. Patients are likely to experience a sense of accomplishment when they are focusing on and mastering one task at a time, because learners who are ill may be facing fatigue or decreased stamina and attention. Lengthy sessions are less beneficial. Data integration. Patient education plans require steps to assist the learners with integrating the newly acquired information into their lives. When presenting healthcare materials, the nurse should use basic terminology that is easily understood by the learner and is consistent with the individual's health literacy level. Instructions should be present in a clear, concise way at a learner-appropriate level. Information should be presented by starting with familiar concepts and progressing to the less familiar complex of abstract ideas. A variety of teaching methods can be combined to match content with learning style. Examples include verbal instruction, such as computer-assisted programs and digital media, demonstration and return demonstration, and written instructions. Providing patients with material written in their native language at the end of the session gives them the opportunity to review what they have learned, allowing effective integration of the information. Repetition and demonstration. Newly presented information or techniques should be reviewed at the end of the session with adequate time allowed for questions and demonstration. Having the patient practice a task is extremely beneficial because it enables the nurse to provide immediate feedback, correct errors, and ensure that the patient comprehended the material as it was intended. In some instances, the patient may observe by computer or other format a skill being performed in a simulation scenario until the patient is able to perform the skill. These sessions give the nurse ample opportunity to provide praise and positive feedback to the learner. In all patient education situations, having the patient repeat the information or a return demonstration by the patient helps the nurse assess the level of learning that has taken place. Evaluation. Ongoing evaluation of patient education occurs by each member of the healthcare team to provide teaching according to the patient's teaching plan. Having the learner repeat what has been learned can help the nurse evaluate the teaching plan and adjust the plan for future patient education sessions. Okay, sorry, my animals, one thing.